Burning eyes that stream in water but still feel like there's sand in them. Gritty by mid-morning, sore by the evening, and no eye drop you've tried has properly touched it. Those are dry eye symptoms, and you've probably been told exactly that. Given drops and sent on your way. And they barely help. And that isn't anyone failing you. A standard appointment is 10 minutes. Long enough to make the diagnosis, rarely long enough for the whole picture. So here's the part there usually isn't time to explain. Dry eye is almost never one thing. It's usually a mix. The same gritty, burning, watery eye can be driven by a few different causes at once, and they overlap, and they feed each other. But for most people, one of them is doing the most damage. Find that one, and you know exactly where to start. I'm Mr. Dilraj Sahota, consultant ophthalmologist in the West Midlands in the UK, and I untangle this exact mix every week. And there's one simple thing that helps whichever type you've got. I'll give it to you at the end. First, let's find your main driver. 1. Screens. The tell. Your eyes are fine in the morning and get worse throughout the day, and then noticeably better at weekends or on holiday. Both eyes equally. Tired, heavy, a bit blurry after a long stint on a monitor or a phone. If that's your strongest pattern, screens are very likely your loudest driver. You stop blinking properly when you concentrate, and this is subconscious. The eye surface dries out. It's often the most reversible of the three, and I've made a full video on exactly why it happens and how to stop it. 2. The oil glands in your eyelids, the tell. Burning and grittiness most of the time, not just after screens. The watery eye paradox, eyes streaming yet feeling dry. Worse in wind or air conditioning, or when you go outside. And the giveaway, you've tried a warm compress and it helped only a little or not at all. If that fits, the loudest driver is likely the tiny oil glands, the meibomian glands along your eyelids, clogging up. And there's a specific reason the standard warm compress often doesn't fix it. That's a whole video of its own, and for a lot of you, it's the important one. 3. The eyelid margins themselves, blepharitis. The tell, worst first thing in the morning, crusty, flaky, or stuck together lashes when you wake, red, sometimes itchy lid edges, maybe the odd recurrent little lump or sty. That morning worse pattern is the big clue. If your eyes are worse waking up than at bedtime, it points squarely at the lids. It's a different treatment routine, and I have a full video on treating it when nothing else has. Now, here's the honest and important bit. These aren't separate diseases sitting in 3 separate boxes. They're 3 ways of tipping the same delicate ocular surface into one vicious cycle. Screens make you blink less. Less blinking clogs the oil glands, and clogged glands and crusty lids inflame the surface of the eye. And once that surface is irritated, it stays irritated. So if 2 or even all 3 of those patterns sounded like you, that isn't you getting it wrong. That's the normal picture. Most people are a blend, with one driver louder than the rest. You're just working out which is loudest for you. So what do you do while you work out which driver is the loudest? Here's that simple thing, and it helps more or less every one of them because you're really dealing with just one. Blink properly. Not the lazy half blinks which we subconsciously do at screens. Complete full blinks. Close gently all the way, hold for 2 seconds, and then open. A handful of times, several times a day. That one simple habit rests a screen-strained eye, and a complete blink actually presses on those oil glands and helps squeeze the oil out, keeping them flowing. Pair it with a proper hot compress, and you're already working on all 3 drivers at once before you even know which is loudest. 2 things to be straight with you about. There's one cause that I haven't covered. Some people simply don't make enough tears in the first place. That is a different mechanism and occasionally part of a wider health condition. So if none of these 3 patterns fit you, or you've worked at them and got nowhere, that's a reason to get properly assessed rather than keep guessing. And the line to take seriously. A red, genuinely painful eye, especially with real sensitivity to light, or a sudden change in your vision, is none of this. That's not something to sort out at home. See someone urgently, your optician, 111, or an urgent eye service. If you take one thing away, it's this. Dry eye symptoms usually aren't one problem, but a mix. Most often screens, the oil glands, and the eyelid margins overlapping and feeding one vicious cycle. Work out which pattern fits you best. Start blinking fully and heating your lids today, because that helps all of them. Then go deeper on the one that's loudest. So which sounded most like you? Comment below. You might find more than one that fits.